So we are recording this call just for content. I don't know what'll come out of it, but just wanted to let you guys know. And it popped up and told me to tell you. So um,
Oh,
you know, I, the thought behind this was just, we talk to a lot of different practices on a daily basis, and we're hearing what you guys are doing, and everybody's doing stuff a little bit differently. I think everybody's common goal is to, keep providing care for your patients, and also keep, providing jobs to your employees, and all that kind of stuff. So everyone's got the same goal. We wanted to use our position to bring you guys together in case anybody had any.
Tanya
Hey
is now
Tanya,
joining.
hey Tanya, just bring everybody together at a place to share information, different ways you're handling this. I would like to go around and call on people specifically to ask a few questions. If you're not comfortable, just let me know when I ask you, and we'll go on to the next. Just starting off with how is the practice that you work for? How have you dealt with what's going on? That's pretty vague, but so share whatever you want, and I can get more specific if we need be. But I'll start with Tammy, if you don't mind.
Well, I'll actually let Kelly and Mindy answer or address it because they're the ones that are pretty much running the practice.
Okay.
Kelly, you want to go first?
Oh, well, thanks
Wow.
a lot, Mindy. I mean, I guess the first thing we kind of tried to do is deal with the panic, and and how we were addressing our patients and get everybody on board, kind of doing the same thing. And it was hard, especially with having 2 locations and so many departments, and it's really hard to get really fast changes out to everybody all at once. But I mean, I think patients still had other issues that were totally not related to COVID-19, and we had to figure out a way quick to still do those things and protect everybody, I guess. So I don't know, I think me and Mindy just kind of started running with no idea where we were going.
Right.
Are y'all patient visits? Is it decreased?
Yeah, they started decreasing immediately, with depending on, what patients had what outlet of information. But seeing that, we, started the telehealth doing audio and video visits pretty quickly. And I mean, right now, today, all the doctors, the majority of their visits were telehealth visits today. So I think again, another thing that me and Mindy just kind of took off running, and we weren't sure if we were going to run into a brick wall or if it was actually going to work, but it works. The patients that are still wanting to come into the office, we're doing the best we can as far as separating people, wearing masks, cleaning, separating well from sick, and that's just kind of any kind of sick, just because there's so much still we don't know about any of this. We're limiting people in the office as far as, patients bringing their families, neighbors, and anybody else they want to ride with. So, and that's all we can do, I guess.
Well, one thing, this is Tammy, we're all the employees, a friend of mine made masks for everybody, so all the employees are wearing the mask anyway for, like, when we're talking to each other in our office, or we're walking down the halls, or we talk to anybody, you have your mask on.
Right.
Just as a precaution for us. We're seeing well visits in the mornings and sick visits in the afternoon, and but again, most of those have now gone into televisits. and next week we're actually reducing our hours. That's seeing patients just because so many patients have canceled because they're afraid to come in.
How about Lenny? How about you? Lenny works for a pretty good sized practice. How you guys handle it, Lenny?
Well, our biggest concern, number one, our volume has dropped so much because of this. I mean, normally we'll do, between all three of our ASCs, we'll usually do well over 100 procedures a day, and I think today we did 8. So we're trying to manage the staff correctly without, our ultimate goal is to keep the staff and not lose people. So we split the staff into 2 teams now, depending on the length and where our volume sticks, into maybe 3 teams where we're going. We've closed the 2 satellites, and we're working one group of employees 1 week on, 1 week off, and doing all the procedures at our Dallas Springs location. Now, I was tasked Monday because in the past we had looked into telehealth, and just because of the reimbursement, it didn't make sense for GI to do telehealth. But Monday, our owners wanted to do telehealth, and so I had 2 days to find a platform and roll it out. And I completed that yesterday, and we rolled it out today. And in a matter of, I don't know, they probably had an hour to find patients, and we were able to get 11 on our schedule just in a matter of 60 minutes. So
what'd you choose for telehealth, Lenny?
Well, I went with Doxy.me because it was so, number one, it's ridiculously cheap. You don't have to sign a contract. And if you do the clinic version, it's depending on how many providers you have, you can get up to 20% off. So, we ended up paying about $46 a provider. And ultimately, we're just using it as a communication tool so the doctor and the patient can get eye contact with each other. We're still doing all the documentation and data entry into our EMR.
Okay, hold on.
But Doxy.me, I'm telling you, for smartphones, tablets, it is so easy for the patient because you just send them a text when the doctor's ready, or you give them the URL and they just they hit it and they're in the room, and it's great.
That's awesome.
What's the phone that shows up when you call the patient, or what shows up?
Well, okay, this is our workflow. This is the biggest. The technological piece was super simple. The workflow was another story. The way we do it, we just have our normal schedulers, and like for instance, the people that enter our PIFs, they call them on just a regular landline from our office, and they verify the insurance, and then the PIF person enters the medical history and the medication reconciliation, and then they give the patient the URL to go to in either Safari, Chrome, or Firefox, and it automatically goes into that provider's room. So it's a randomly generated. If I send them the invitation through the app or through the website, it would be some crazy cell phone number that it's not related to GI or the employee or the provider.
Okay. Well, we're using, and it's $20 for physicians, no charge for the nurse practitioners for 6 months.
Okay. Well, see, ours is month to month. So, in 2 weeks when this is over and everybody stops losing their mind, I don't know how much.
So ours is month to month too. We did ours month to month, but it's for 6 months at this reduced rate.
Yeah, right. And that makes sense. And to be honest with you, in the future going forward, I know we won't keep 19 of them, but, I could easily see us using a couple of nurse practitioners' accounts, and we'll probably add our weight loss program into it because you can do group calls. You don't want to do that with a patient, but, if you had a weight loss group, you could do a group call with them. But, it's a good Band-Aid, and it generates some revenue, especially now that Blue Cross and Medicare is paying for a full office visit using telehealth for the first time. So that's a plus.
Is there anyone on the call who's not using telemed yet? What about Tanya? I think you jumped on. Are y'all doing anything yet?
I think that we have offered that to patients who we are rescheduling. It's a little different for us because I'm in an ophthalmology group, and our visits kind of are based on what the surgery center is allowed to do. Most of our procedures, cataract surgery, that's elective. And right now we can't do elective procedures at our surgery center. So our visits have decreased significantly. If it's a routine exam, something that can wait, then of course we're rescheduling them, maybe a month or 2 months down the road. But, if a patient does feel like they have something urgent, we are giving them that option. I don't know if maybe Dr. Pruitt maybe has made a call or two, but I've not heard of anybody else, Cody, at this point.
Okay.
So I just went through, this is Kelly, so I just went through our schedules real quick because I personally was kind of curious on how many we did in office and how many telehealth we did today. So the two offices combined, we actually did the same. We did 31 in-office visits and 31 telehealth visits.
Wow. Are the telehealth, are they faster? Are you seeing that happen? The appointments?
No, it takes a little bit longer from what we've seen, just because, I mean, on the annual wellness visits, like Dr. Ivy, she's, having her nurse go ahead and call, verify medications, allergies, and that kind of stuff. But the other providers are kind of doing it on their own. So that takes a little bit longer because you don't have the nurse, physically checking in that patient and doing all that stuff like they were in the office. So it does take a little bit longer. We've given them longer appointment times for these. We've actually jumped them up to 30 minutes, but they seem to like it.
Well,
same for you, Lenny.
The biggest complaint that I've had from my providers is on a follow-up or a revisit, it's rare that they have to sit and talk to a patient for 30 minutes. I mean, but with telehealth, it's all time. Your pay it's all time-based. So I mean, it's very important that they hit those time markers for a visit. And a lot of especially the older docs, they wasn't crazy about having to sit there and kill 30 minutes, to try to get to the level 3 or level 2 at least. Because if you're just doing a level 1 billing, you're losing money, or they're losing money based on what it pays to sit there and just try to come up with something to talk about. So I think handling the patients, the front end's probably 1,000 times easier, but actually having the provider in the so-called room with the patient, that's the toughest part.
Hey, will you say the name of that platform you're using again, Lenny?
Yes, it's Doxy, DOXY .me, M-E.
Okay, thank you.
They have, you're welcome. They have a free version, a professional version, and a clinic version.
From my experience, I don't know if he's on the call. I had an appointment with one of our customers for my son on Tuesday, I believe, and they used Doxy.me, and it was pretty smooth. So they called me from the front desk, got my copay information, and then they sent me a link to my phone, and I clicked on it, and at that point, it put me into the basically like the virtual waiting room, and the doctor picked it up, and they set me in a room, and a nurse came, put in a normal appointment, and got us ready, and then said we'll be right back with you. And the doctor came in, sat down. It was a checkup on a broken arm, so they just needed to check for mobility and that kind of stuff. But man, it was pretty smooth, and not have to leave the house, not have to get my 5-year-old son in the car, and then have to take him to get a surprise just because we got in the car, stuff like that. It was pretty smooth.
Are there any other ophthalmology groups on this call, Cody?
You are the only one. The other one had to back out.
Okay. I was just curious if any other ophthalmology groups were using any of these platforms.
Yeah, I talked to another one yesterday, and they hadn't done it yet, and I kind of explained it a little bit more in depth, and they thought there were some of the few, visual visits that they could have definitely done over telemed.
Right.
When they get into tests and stuff, they wouldn't be able to run. But I think there's probably a little bit of opportunity there for you guys.
Yeah.
Well, let me throw this out here too with everybody. I'm sure these guys on this call know this as well, but I mean, they have laxed the requirements for a telehealth visit like crazy during this little epidemic we're having right now. I mean, after this is over, I expect a lot of the requirements to go back up. Right now, they're pretty lax during this time, so I think they'll change again. I think they'll go back the way they were.
Well, they said they were only going to keep them right now for 90 days, and then they will go back.
Yeah, exactly. Right. So, it's just one of those things.
Other parts of the business, has there been challenges with I guess you guys, for the most part, have to be in the office to work. You probably have some people that can work remote. In those situations, is there anything you've found helpful to be able to communicate with your team and keep the business running? Or are all you guys still in the office full time?
Is now exiting.
We've got everybody in the office.
Right now we have everybody in the office, Cody. We're just waiting to see how this bill does in the House on Friday, and that will kind of direct a lot of what we do in the coming weeks.
Yeah. What about you, Lenny?
Yeah, I mean, it's the same thing. I mean, like I said, we're going to cut the staff pretty much in half. We really need to cut it 2/3, but, whatever. We're going to cut it in half starting Monday. But no, there's not been any problems. I mean, it's pretty fluid. I mean, all of our employees can access webmail, and the only thing I wish I would have done is I wish I'd implemented our 2-factor before this, but I didn't. So oh well, no big deal. But no problems.
Is there any does anybody have any questions for somebody else on the call? Tammy, you always have good questions. You got anything?
Okay, so do you have any patients actually, Lenny, walking in the door?
Oh yeah, we had like I said, we did 8 procedures today, and I think when I left, we were having about we might have had 15 office visits still that showed up that actually came.
So are you taking their temperature when they walk in the door before you let them in the door? Or are you?
Oh, trust me. We got somebody standing in the airlock when they come in any of our entrances, whether you're delivering the mail, whether you're picking up linens, or you're a patient, or you're an employee, or a director, or a doctor. You're getting your temperature taken before you get in the building. Yes.
Our problem is we don't have those head ones. We just have the other, and our probes for, I guess that's what they're called, to take your temperature are back ordered. So.
Well, let me tell you what we did right there. We were using the ear ones, okay? We were using the ear ones, and then they ordered the infrared ones. But we got the infrared ones in yesterday, that they were a full degree different than the ear ones. So they decided today to go back to using the ear ones. So that's what we're doing.
You cut out because somebody was typing on their computer. What did you say again? You used the ear one, and then the other one was for
full degree, a full like okay.
A full degree. Okay.
Yeah. They took my temperature with the infrared. It was 97.2 or something like that. And then they did it with the ear one. It was 98.2, and that was pretty consistent with everyone. So, you know, so we're back to using the ear one, not the infrared one.
Well, I see that's what everybody's doing, and we don't have enough probes or we're going to run out, and they're back ordered before, so we can't even do that with anybody.
The only thing we're worried about running out of is the PPE for our scope techs and our doctors when they're scoping is the mask. You know, now granted, don't get me wrong, they're not the N95. If they were, I'd have them up on eBay right now. But no, they're just regular. They're just regular masks. But I think we've got right at 1,000, I believe.
So our mask, our cavi wipes, our gloves, our gowns, face shields, everything is on back order, including our toilet paper.
Well, we're in good shape on gowns. I didn't hear him mention cavi wipes. Cavi wipes can get iffy if this goes on much longer, but gowns, and what was the other thing you said?
Well, pretty much everything except hand sanitizer. We got an order of hand sanitizer. Every other thing we use is on back order. Everything.
I got you. Yeah.
I mean, we only have 64 gowns left of the isolation gowns. That's it.
Oh, yikes!
And we're in internal medicine, so.
Do you guys use McKesson? We use McKesson and Cardinal mostly. What do you guys
use? That's McKesson.
Yeah.
And they said, here's your order based on what you ordered before. Well, before we didn't have this situation, and so you're not allotted anything because you didn't order all this stuff before. Well, now we need it and we can't get it because they said you didn't order isolation gowns, before, so you don't get them now.
No, you're not the only one. Trust me. Our ASC director and one of our directors that's what she said. If it's something you hadn't been ordering, they won't let you all of a sudden, order something new right now. That's true. So, oh well, what do you do?
Yeah, nothing. I mean, what can you do?
I know.
Well, unless anybody else has any other questions, we can wrap up. If anybody has any follow-up questions for, any of the people you talk to, I've got access to all of them. So, thanks for all your help. It sounds like, everybody's kind of far along with telemed. If there's anything that that we can ever do to help with that, feel free to reach out to me. And if anything else technology-wise that we can help you in this time, just don't hesitate.
Great.
Okay, just keep your fingers crossed that our hosting is going to work on Monday.
Yeah, Tammy's doing a big EMR migration this weekend. So is Tanya.
Let me tell you how fun that was.
The timing is great, right?
Yeah, we're all busy, so we'll talk to you later.
All right.
Okay,
thank
you.
Cody, thanks for doing this.
All righty, thanks. Bye.
All right, see ya.
Bye.
Multiple people are now exiting.